Do you want to successfully complete the D446 objective assessment exam? Then you are in the right place. Our website provides a list of questions and answers for your success in the D446 OA exam for free. We understand that acing your OA exam can be quite challenging. That's why we provide completely free exam guides and practice questions for you. In this video, we will cover questions from renal system management, cardiovascular disorders, respiratory care, musculoskeletal conditions, and gastrointestinal issues. So, let's get started. 1. A nurse caring for a patient with peripheral arterial disease notices absent pedal pulses and shiny skin on the lower extremities. Which intervention should the nurse prioritise to promote circulation? A. Elevate legs above heart. B. Apply compression stockings. C. Encourage leg dangling. D. Use heating pads. Can you guess the answer? Correct answer, C. Encourage leg dangling. Explanation. Option C is correct because dangling the legs uses gravity to promote arterial blood flow to the extremities, which is essential for patients with peripheral arterial disease experiencing oxygen deprivation. Option A is incorrect because elevating legs above the heart would reduce arterial blood flow to the extremities, worsening the condition in peripheral arterial disease patients. Option B is incorrect because compression stockings are used for venous disease to prevent pooling, not for arterial disease where blood flow is already compromised. Option D is incorrect because heating pads are contraindicated in peripheral arterial disease due to decreased sensation and risk of burns from impaired circulation. Let's dive into the critical differences between peripheral arterial disease and peripheral venous disease to understand why leg positioning matters so much. In peripheral arterial disease, the arteries are narrowed by atherosclerosis, which means oxygen-rich blood struggles to reach the lower extremities. This creates an oxygen deficit in the tissues. When we dangle the legs, gravity assists in pulling blood down into these oxygen-starved tissues. In contrast, elevating the legs would work against gravity, further reducing arterial flow to already compromised areas. Compression stockings are contraindicated because they would squeeze already narrowed vessels. Heating pads are dangerous because the reduced sensation from poor circulation increases burn risk. 2. A patient with left-sided heart failure presents with crackles in the lungs and orthopnea. What medication would the nurse anticipate administering first to address fluid overload? A. Beta blocker. B. Furosemide. C. Morphine sulfate. D. Nitroglycerin. Do you know the answer? Correct answer, B. Furosemide. Explanation. Option B is correct because furosemide is a loop diuretic that rapidly removes excess fluid from the lungs, providing immediate relief from pulmonary congestion in left-sided heart failure. Option A is incorrect because beta blockers are used for long-term management of heart failure, not for acute pulmonary congestion requiring immediate intervention. Option C is incorrect because morphine is primarily used to reduce anxiety and decrease myocardial oxygen demand, not to directly address fluid overload. Option D is incorrect because nitroglycerin is used for chest pain and reducing preload but doesn't directly remove fluid like diuretics do. Alright, let's explore why furosemide is the go-to medication for acute left-sided heart failure with pulmonary congestion. When the left ventricle fails, blood backs up into the lungs, causing fluid to leak into the alveoli. This creates the crackles we hear and the orthopnea patients experience. Furosemide is a powerful loop diuretic that works within minutes when given intravenously. It rapidly removes excess fluid from the body, including the fluid drowning the lungs. Beta blockers help long-term but won't quickly clear fluid. Morphine reduces anxiety but doesn't directly remove the fluid, causing the immediate crisis. Nitroglycerin helps with preload, but isn't as effective as furosemide for rapid fluid removal. 3. During assessment of a patient receiving hemodialysis, the nurse notes muscle twitching and mental confusion. Which complication should the nurse suspect based on these manifestations? A. Arterial steal syndrome. B. Blood clotting. C. Disequilibrium syndrome. D. Access site infection. Can you guess the answer? Correct answer. C. Disequilibrium syndrome. Explanation: option C is correct because disequilibrium syndrome occurs from rapid removal of solutes during hemodialysis, causing neurological symptoms including mental confusion, restlessness, and muscle twitching. Option A is incorrect because arterial steal syndrome presents with pallor, diminished pulse, and pain in the affected extremity, not neurological symptoms. Option B is incorrect because blood clotting would manifest as decreased flow through the dialysis access, not with neurological symptoms like confusion. Option D is incorrect because access site infection would present with local signs like redness, warmth, and drainage, not mental status changes. To understand disequilibrium syndrome during hemodialysis, let's examine what happens when we remove waste products too quickly from the blood. During dialysis, the machine rapidly pulls urea and other solutes from the bloodstream. However, the brain has a protective barrier that slows the movement of these substances. This creates an osmotic gradient where the brain temporarily has more solutes than the blood. Water follows the concentration gradient and moves into brain cells, causing cerebral edema. This manifests as confusion, headache, and muscle twitching. It's different from arterial steal syndrome, which affects limb perfusion, or infection which causes fever and local signs. 4. A patient with amyotrophic lateral sclerosis is experiencing progressive dysphagia. What nursing intervention takes highest priority to prevent complications in this patient? A. Provide thickened liquids. B. Monitor respiratory status. C. Encourage oral intake. D. Perform range exercises. Do you know the answer? Correct answer. B. Monitor respiratory status. Explanation. Option B is correct because dysphagia increases aspiration risk, which can lead to pneumonia and respiratory failure, the leading cause of death in ALS patients. Option A is incorrect because while thickened liquids help with swallowing, monitoring respiratory status takes priority to detect early signs of aspiration. Option C is incorrect because encouraging oral intake without proper precautions could increase aspiration risk in patients with progressive dysphagia. Option D is incorrect because range of motion exercises, while important for maintaining function, don't address the immediate aspiration risk. Let's examine why respiratory monitoring takes priority in ALS patients with dysphagia. Amyotrophic lateral sclerosis progressively destroys motor neurons controlling voluntary muscles, including those for swallowing and breathing. When dysphagia develops, the risk isn't just difficulty eating. The real danger is aspiration, where food or liquids enter the lungs instead of the stomach. This leads to aspiration pneumonia, which combined with already weakening respiratory muscles, causes respiratory failure. This is the primary cause of death in ALS. While thickened liquids help, monitoring breathing detects early aspiration signs. Range exercises maintain function, but don't address the immediate life threat. 5. A nurse is educating a patient with chronic obstructive pulmonary disease about oxygen therapy. What target oxygen saturation range should the nurse teach to prevent carbon dioxide retention? A. 95%. B. 88%. C. 100%. D. 75%. Can you guess the answer? Correct answer. B. 88%. Explanation. Option B is correct because COPD patients should maintain oxygen saturation between 88 to 92% to prevent hypercapnia from suppressing their hypoxic respiratory drive. Option A is incorrect because maintaining saturation at 95% or higher can suppress the hypoxic drive, leading to dangerous carbon dioxide retention. Option C is incorrect because 100% saturation would severely suppress respiratory drive in COPD patients, potentially causing respiratory arrest. Option D is incorrect because 75% is too low and would result in significant hypoxemia and tissue damage. Understanding oxygen therapy in COPD requires grasping why too much oxygen can be deadly. COPD patients develop chronic carbon dioxide retention because their damaged lungs can't effectively exhale it. Over time, their respiratory center becomes less sensitive to high CO2 levels. Instead, they rely on low oxygen levels, their hypoxic drive, to stimulate breathing. When we give too much oxygen, raising saturation above 92%, we remove this hypoxic drive. The brain thinks everything is fine and stops sending strong signals to breathe. Carbon dioxide accumulates further, causing respiratory acidosis and potentially respiratory arrest. That's why we target 88 to 92% saturation. 6. A patient with diabetes insipidus is admitted with excessive urination and thirst. Which laboratory finding would the nurse expect to see in this condition? A. Low serum sodium. B. High urine concentration. C. Low urine-specific gravity. D. Elevated blood glucose. Do you know the answer? Correct answer, C. Low urine-specific gravity. Explanation. Option C is correct because diabetes insipidus causes inability to concentrate urine due to ADH deficiency, resulting in dilute urine with low specific gravity. Option A is incorrect because diabetes insipidus typically causes high serum sodium due to excessive water loss, not low sodium levels. Option B is incorrect because diabetes insipidus produces large volumes of dilute urine, not concentrated urine with high specific gravity. Option D is incorrect because diabetes insipidus affects water regulation, not glucose metabolism, so blood glucose levels remain normal. Let's break down why diabetes insipidus creates dilute urine despite the body's dehydration. This condition involves antidiuretic hormone, or ADH, which normally tells the kidneys to reabsorb water. Without enough ADH, the kidneys can't concentrate urine, so water passes straight through. The patient produces massive amounts of very dilute urine, up to 20 litres daily. This dilute urine has a low specific gravity because it's mostly water with few dissolved substances. Meanwhile, the blood becomes concentrated as water is lost, causing high sodium levels, not low. This is completely different from diabetes mellitus, where blood glucose is elevated. Here, glucose stays normal because this is a water problem, not a sugar problem. 7. During post-operative assessment of a transurethral resection of prostate patient, the nurse observes bright red bleeding with clots. What immediate action should the nurse take? A. Document normal findings. B. Increase fluid intake. C. Apply traction to catheter. D. Notify the provider. Can you guess the answer? Correct answer, D. Notify the provider. Explanation. Option D is correct because bright red bleeding with clots indicates arterial bleeding, which is abnormal post-TURP and requires immediate medical intervention to prevent hemorrhage. Option A is incorrect because bright red bleeding with clots is not normal after TURP. Expected drainage is light pink to clear. Option B is incorrect because increasing fluids alone won't stop arterial bleeding and delays necessary medical intervention for this complication. Option C is incorrect because applying traction without provider orders could cause additional tissue damage and worsen the bleeding. To understand post-TURP bleeding complications, let's examine what normal versus abnormal drainage looks like. After transurethral resection of the prostate, continuous bladder irrigation keeps blood clots from blocking the catheter. Normal drainage appears light pink to clear as healing progresses. However, bright red blood with clots signals arterial bleeding, a surgical emergency. This isn't expected drainage that you simply document. Arterial bleeding can quickly lead to hemorrhagic shock. Increasing fluids won't stop arterial bleeding. Applying traction without orders could tear more tissue and worsen bleeding. The provider must be notified immediately for potential return to surgery to control the bleeding source. 8. A patient with rheumatoid arthritis taking methotrexate reports severe fatigue and easy bruising. Which adverse effect should the nurse suspect based on these symptoms? A. Kidney dysfunction. B. Bone marrow suppression. C. Liver toxicity. D. Gastrointestinal bleeding. Do you know the answer? Correct answer, B. Bone marrow suppression. Explanation. Option B is correct because methotrexate can cause bone marrow suppression, leading to anemia causing fatigue and thrombocytopenia causing easy bruising in patients. Option A is incorrect because kidney dysfunction would present with edema, decreased urine output, and elevated creatinine, not bruising and fatigue. Option C is incorrect because liver toxicity typically presents with jaundice, abdominal pain, and elevated liver enzymes, not the symptoms described. Option D is incorrect because gastrointestinal bleeding would present with black tarry stools or hematemesis, not easy bruising on the skin. Let's explore how methotrexate causes bone marrow suppression and its characteristic symptoms. Methotrexate is an antimetabolite that interferes with DNA synthesis, affecting rapidly dividing cells. The bone marrow, constantly producing blood cells, is particularly vulnerable. When suppressed, it can't produce adequate red blood cells, causing anemia that manifests as severe fatigue. It also can't produce enough platelets, leading to thrombocytopenia and easy bruising. White blood cell production decreases too, increasing infection risk. While methotrexate can cause liver toxicity with jaundice, the combination of fatigue and bruising specifically points to bone marrow suppression. Kidney dysfunction would cause edema, not bruising. 9. A nurse is caring for a patient with syndrome of inappropriate antidiuretic hormone. Which intervention is most important to implement for this patient's safety? A. Encourage fluid intake. B. Restrict fluid intake. C. Increase sodium intake. D. Monitor blood pressure. Can you guess the answer? Correct answer, B. Restrict fluid intake. Explanation. Option B is correct because SEED causes water retention and dilutional hyponatremia, so fluid restriction is essential to prevent seizures from severe hyponatremia. Option A is incorrect because encouraging fluid intake would worsen water retention and hyponatremia, potentially causing seizures or coma. Option C is incorrect because simply increasing sodium intake won't correct the underlying problem of excessive water retention in SEED. Option D is incorrect because while monitoring blood pressure is important, fluid restriction is the primary intervention to prevent life-threatening complications. Understanding SEAD requires knowing how excess antidiuretic hormone creates a dangerous situation. In SEAD, the body produces too much ADH, causing the kidneys to retain excessive water. This retained water dilutes the blood, dropping sodium concentration dangerously low. Hyponatremia below 120 can trigger seizures as brain cells swell from the osmotic shift. The treatment seems counterintuitive but makes sense. Restrict fluids to prevent further dilution. Encouraging fluids would worsen the water retention and drop sodium levels further, potentially causing coma. Simply increasing sodium won't work because the excess water will just dilute it. While monitoring blood pressure matters, fluid restriction is the primary intervention. 10. A patient with chronic pancreatitis presents with steatorrhea and weight loss. Which medication should the nurse anticipate administering with meals to improve nutrient absorption? A. Proton pump inhibitor. B. Histamine receptor blocker. C. Pancreatic enzymes. D. Bile acid sequestrant. Do you know the answer? Correct answer, C. Pancreatic enzymes. Explanation. Option C is correct because pancreatic enzyme supplements replace the digestive enzymes the damaged pancreas can't produce, improving fat digestion and reducing steatorrhea. Option A is incorrect because proton pump inhibitors reduce acid production, but don't replace the missing pancreatic enzymes needed for digestion. Option B is incorrect because histamine receptor blockers reduce stomach acid, but don't address the enzyme deficiency causing malabsorption. Option D is incorrect because bile acid sequestrants bind bile acids, but don't provide the pancreatic enzymes needed for proper digestion. To understand chronic pancreatitis treatment, let's examine why pancreatic enzymes are essential for these patients. The pancreas normally produces lipase, amylase, and protease to digest fats, carbohydrates, and proteins. In chronic pancreatitis, repeated inflammation causes permanent scarring and fibrosis. The damaged pancreas can't produce enough digestive enzymes. Without lipase, fats pass through undigested, creating steatorrhea, those greasy, foul-smelling stools. This malabsorption leads to weight loss and nutritional deficiencies. Pancreatic enzyme supplements taken with meals replace what the pancreas can't make. Proton pump inhibitors reduce acid but don't provide enzymes. 11. During assessment of a patient with Cushing's disease, which combination of findings would the nurse expect to observe? A. Weight loss hypertension. B. Moon face, hyperglycemia. C. Cold intolerance, bradycardia. D. Butterfly rash, photosensitivity. Can you guess the answer? Correct answer, B. Moon face, hyperglycemia. Explanation. Option B is correct because Cushing's disease causes excess cortisol, resulting in characteristic moon face from fat redistribution and hyperglycemia from increased gluconeogenesis. Option A is incorrect because Cushing's disease causes weight gain and hypertension from excess cortisol, not weight loss and hypertension. Option C is incorrect because cold intolerance and bradycardia are signs of hypothyroidism, not the hypercortisolism seen in Cushing's disease. Option D is incorrect because butterfly rash and photosensitivity are characteristic of systemic lupus erythematosus, not Cushing's disease. Let's examine the classic presentation of Cushing's disease and how excess cortisol creates these distinctive features. Cushing's disease results from excessive cortisol production, usually from a pituitary tumour. This excess cortisol redistributes body fat in characteristic ways. Fat accumulates in the face, creating the moon face appearance, and between the shoulders forming a buffalo hump. Cortisol also increases gluconeogenesis in the liver, producing new glucose. This raises blood sugar levels, causing hyperglycemia. The opposite presentation of weight loss and hypertension indicates Addison's disease with insufficient cortisol. Cold intolerance and bradycardia suggest hypothyroidism. 12. A patient recovering from extensive burns develops purulent drainage from wound sites. What laboratory value should the nurse review first to assess for systemic infection? A. Serum albumin level. B. White blood cell count. C. Hemoglobin level. D. Platelet count. Do you know the answer? Correct answer, B. White blood cell count. Explanation. Option B is correct because white blood cell count elevation indicates systemic infection, which is a major complication in burn patients with purulent drainage. Option A is incorrect because serum albumin reflects nutritional status and protein loss, not the presence of active infection requiring assessment. Option C is incorrect because hemoglobin level indicates oxygen carrying capacity and possible anemia, not the presence of infection. Option D is incorrect because platelet count relates to clotting ability, not the immune response to infection in burn wounds. Understanding infection assessment in burn patients requires recognizing why white blood cell count is the key indicator. Extensive burns destroy the skin's protective barrier, creating massive open wounds vulnerable to bacteria. When infection develops, the immune system responds by producing more white blood cells to fight the invading organisms. An elevated white blood cell count indicates this systemic immune response to infection. This is more specific than albumin, which drops due to protein loss through wounds, not infection. Hemoglobin reflects oxygen capacity and possible anemia from blood loss. The WBC gives us direct evidence. 13. A nurse is teaching a patient with gout about allopurinol therapy. Which instruction is most important to prevent complications from this medication? A. Take with food. B. Increase fluid intake. C. Avoid sun exposure. D. Monitor blood pressure. Can you guess the answer? Correct answer, B. Increase fluid intake. Explanation. Option B is correct because increased hydration is crucial with allopurinol to prevent uric acid crystal formation in the kidneys as uric acid levels decrease. Option A is incorrect because while taking with food may reduce stomach upset, hydration is more critical for preventing kidney stones. Option C is incorrect because allopurinol doesn't cause photosensitivity, unlike some other medications used for inflammatory conditions. Option D is incorrect because allopurinol doesn't significantly affect blood pressure, making this monitoring less critical than maintaining hydration. Let's explore why hydration is absolutely critical when taking allopurinol for gout management. Allopurinol works by inhibiting xanthine oxidase, the enzyme that produces uric acid. As it lowers blood uric acid levels, the excess uric acid must be eliminated through the kidneys. Without adequate hydration, this uric acid can crystallize in the kidney tubules, forming kidney stones. These stones can cause excruciating pain and kidney damage. Drinking at least 3 litres daily keeps urine dilute, preventing crystal formation. Taking with food helps stomach comfort, but doesn't prevent kidney stones. 14. A patient with end-stage renal disease missed a dialysis appointment. Which electrolyte imbalance poses the greatest immediate threat to this patient? A. Hypercalcemia. B. Hyperkalemia. C. Hyponatremia. D. Hypophosphatemia. Do you know the answer? Correct answer, B. Hyperkalemia. Explanation. Option B is correct because hyperkalemia from missed dialysis can cause fatal cardiac arrhythmias, making it the most immediately life-threatening electrolyte imbalance. Option A is incorrect because hypercalcemia develops gradually in renal disease and doesn't pose the same immediate cardiac risk as hyperkalemia. Option C is incorrect because hyponatremia in renal disease is usually mild and doesn't cause the acute cardiac complications of hyperkalemia. Option D is incorrect because end-stage renal disease typically causes hyperphosphatemia, not hypophosphatemia, and this doesn't pose immediate cardiac risk. To understand why hyperkalemia is the most dangerous electrolyte imbalance in missed dialysis, let's examine its cardiac effects. The kidneys normally excrete excess potassium daily. When dialysis is missed in end-stage renal disease, potassium accumulates rapidly in the blood. High potassium disrupts the electrical conduction system of the heart. It can trigger ventricular fibrillation, or a systole within hours. This makes hyperkalemia immediately life-threatening. Unlike other electrolyte imbalances, hypercalcemia develops slowly and causes muscle cramps, not sudden death. Hyponatremia in renal disease is usually mild. 15. A patient presents with severe headache, facial droop, and elevated blood pressure. Which type of stroke should the nurse suspect based on these symptoms? A. Ischemic stroke. B. Hemorrhagic stroke. C. Transient attack. D. Lacunar infarct. Can you guess the answer? Correct answer, B. Hemorrhagic stroke. Explanation. Option B is correct because hemorrhagic stroke presents with severe headache from bleeding, elevated blood pressure as a cause, and neurological deficits like facial droop. Option A is incorrect because ischemic stroke typically doesn't present with severe headache, which is more characteristic of bleeding in the brain. Option C is incorrect because transient ischemic attacks resolve within 24 hours and don't typically cause severe headache. Option D is incorrect because lacunar infarcts are small ischemic strokes that rarely present with severe headache or significantly elevated blood pressure. Let's differentiate hemorrhagic from ischemic stroke to understand why severe headache points to bleeding. Hemorrhagic stroke occurs when a blood vessel ruptures in the brain, spilling blood into surrounding tissue. This bleeding causes sudden, severe headache, often described as the worst headache of one's life. The blood irritates brain tissue and increases intracranial pressure rapidly. Elevated blood pressure often causes the vessel rupture initially. In contrast, ischemic strokes from blocked vessels typically don't cause severe headache because there's no bleeding or sudden pressure change. The combination of severe headache with neurological deficits strongly suggests hemorrhage. 16. A nurse is assessing a patient with peripheral venous disease. Which finding would be most characteristic of this condition versus arterial disease? A. Absent pedal pulses. B. Intermittent claudication. C. Brown ankle discoloration. D. Pale, cool extremities. Do you know the answer? Correct answer, C. Brown ankle discoloration. Explanation. Option C is correct because brown discoloration at the ankles results from hemosiderin deposits due to chronic venous pooling, which is characteristic of peripheral venous disease. Option A is incorrect because absent pedal pulses indicate arterial disease with compromised blood flow, not venous disease with normal arterial flow. Option B is incorrect because intermittent claudication is sharp calf pain, with activity seen in arterial disease, not venous insufficiency. Option D is incorrect because pale, cool extremities indicate poor arterial perfusion, while venous disease causes warm, edematous extremities. Understanding peripheral venous disease requires recognizing how chronic venous pooling creates distinctive skin changes. In venous disease, valves in leg veins fail, allowing blood to pool instead of returning to the heart. This pooled blood contains red blood cells that eventually break down, releasing hemoglobin. The hemoglobin degrades into hemosiderin, an iron-containing pigment that permanently stains the skin brown, especially around the ankles. This is pathognomonic for venous disease. In contrast, arterial disease shows absent pulses because arteries are blocked. Intermittent claudication, that sharp calf pain with walking, indicates arterial insufficiency. 17. During tuberculosis treatment with rifampin, isoniazid, pyrazinamide and ethambutol, a patient reports vision changes. Which medication is most likely causing this adverse effect? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Can you guess the answer? Correct answer, D. Ethambutol. Explanation: option D is correct because ethambutol can cause optic neuritis leading to vision changes, requiring immediate discontinuation to prevent permanent vision loss. Option A is incorrect because rifampin typically causes orange discoloration of body fluids and hepatotoxicity, not vision changes. Option B is incorrect because isoniazid commonly causes peripheral neuropathy and hepatotoxicity, not optic problems affecting vision. Option C is incorrect because pyrazinamide primarily causes hyperuricemia and hepatotoxicity, not visual disturbances requiring immediate attention. To understand tuberculosis treatment side effects, let's examine how ethambutol specifically damages vision. The RIPE therapy combines 4 drugs: rifampin, isoniazid, pyrazinamide, and ethambutol. Each has distinct side effects we must monitor. Ethambutol uniquely causes optic neuritis, inflammation of the optic nerve. This can start as blurred vision, colour blindness, or visual field defects. If not caught early, it can cause permanent blindness. That's why vision testing is mandatory before and during treatment. Rifampin turns body fluids orange, but doesn't affect vision. 18. A patient with glomerulonephritis asks about dietary modifications. Which recommendation should the nurse provide to reduce kidney workload? A. High protein intake. B. Low sodium intake. C. High potassium foods. D. Increased fluid intake. Do you know the answer? Correct answer: B. Low sodium intake. Explanation: option B is correct because low sodium intake reduces fluid retention and blood pressure, decreasing the workload on damaged glomeruli in glomerulonephritis. Option A is incorrect because high protein intake increases kidney workload, as the kidneys must filter protein waste products. Option C is incorrect because glomerulonephritis often causes hyperkalemia, so high potassium foods would worsen electrolyte imbalance. Option D is incorrect because increased fluids may worsen edema and hypertension when kidney function is impaired. Let's explore why sodium restriction is crucial in glomerulonephritis management. Glomerulonephritis inflames the kidney's filtering units, the glomeruli. These damaged filters can't properly excrete sodium and water. Excess sodium pulls more water into the blood vessels through osmosis, increasing blood volume. This raises blood pressure, forcing the damaged glomeruli to work even harder. Low sodium intake reduces this fluid retention. This protects remaining kidney function. High protein actually increases kidney workload, as the kidneys must filter protein waste products. High potassium foods worsen hyperkalemia that often accompanies kidney disease. 19. A nurse notices a patient's cast feels hot and has a foul odour. What complication should the nurse suspect is developing? A. Compartment syndrome. B. Infection under cast. C. Pressure ulcer formation. D. Venous thromboembolism. Can you guess the answer? Correct answer: B. Infection under cast. Explanation: option B is correct because heat and foul odour from a cast indicate infection developing under the cast, requiring immediate medical evaluation and intervention. Option A is incorrect because compartment syndrome presents with severe pain, paresthesias, and pulselessness, not heat and odour from the cast. Option C is incorrect because pressure ulcers cause pain and skin breakdown, but do not typically produce heat and foul odour through the cast. Option D is incorrect because venous thromboembolism causes swelling and pain distal to the clot, not heat and odour from the cast. Understanding cast complications helps us recognise why heat and odour specifically indicate infection. When bacteria multiply under a cast, they produce metabolic heat as a byproduct of their rapid reproduction. This warmth radiates through the cast material, making it feel hot to touch. Simultaneously, bacterial breakdown of tissue and the bacteria themselves produce foul-smelling compounds. These volatile organic compounds escape through the cast's porous material. Together, heat and smell are classic infection signs. Compartment syndrome causes severe pain and neurovascular changes, not heat and odour. Pressure ulcers cause pain but don't typically produce significant heat. 20. A patient with Graves' disease is experiencing tachycardia and heat intolerance. Which medication class would best control these symptoms while awaiting definitive treatment? A. Calcium channel blockers. B. Beta blockers. C. ACE inhibitors. D. Loop diuretics. Do you know the answer? Correct answer, B. Beta blockers. Explanation. Option B is correct because beta blockers effectively control hypothyroid symptoms like tachycardia and tremors by blocking the effects of excess thyroid hormone. Option A is incorrect because calcium channel blockers are less effective than beta blockers for controlling hypothyroid-induced tachycardia and tremors. Option C is incorrect because ACE inhibitors affect blood pressure through the renin-angiotensin system, not thyroid-related cardiac symptoms. Option D is incorrect because loop diuretics remove fluid but do not address the underlying hypothyroid symptoms of tachycardia and heat intolerance. Let's examine why beta blockers are the gold standard for controlling hypothyroid symptoms while awaiting definitive treatment. In Graves' disease, excess thyroid hormone overstimulates beta-adrenergic receptors throughout the body. This causes tachycardia, tremors, anxiety, and heat intolerance. Beta blockers directly block these receptors, providing rapid symptom relief within hours. They don't fix the thyroid problem but make patients comfortable. Calcium channel blockers can slow heart rate, but don't address tremors and anxiety as effectively. ACE inhibitors work on blood pressure through a different mechanism unrelated to thyroid symptoms. 21. During peritoneal dialysis, a patient develops abdominal pain, cloudy dialysate, and fever. What immediate action should the nurse take? A. Warm the dialysate. B. Slow infusion rate. C. Culture the effluent. D. Increase dwell time. Can you guess the answer? Correct answer, C. Culture the effluent. Explanation. Option C is correct because cloudy dialysate with fever and pain indicates peritonitis, requiring immediate effluent culture to identify the causative organism for treatment. Option A is incorrect because warming dialysate will not address the infection causing peritonitis and delays necessary diagnostic testing. Option B is incorrect because slowing the infusion rate does not treat the peritonitis infection that requires immediate antibiotic therapy. Option D is incorrect because increasing dwell time could worsen the infection by allowing bacteria more time to multiply. To really understand peritoneal dialysis complications, let's explore why cloudy dialysate with fever signals a medical emergency. During peritoneal dialysis, the sterile dialysis fluid sits in the abdominal cavity, separated from organs by the peritoneum. When bacteria breach this sterile environment, they multiply rapidly in the warm, glucose-rich dialysate. This infection, called peritonitis, turns the normally clear fluid cloudy with white blood cells and bacteria. The infected peritoneum causes severe abdominal pain and triggers systemic fever. Culturing the effluent immediately identifies the specific bacteria for targeted antibiotics. Without prompt treatment, peritonitis can cause sepsis and death. 22. A patient with heart failure gains 5 pounds in 2 days. Which finding would indicate the need for immediate intervention? A. Ankle edema. B. Decreased appetite. C. Pink frothy sputum. D. Mild fatigue. Do you know the answer? Correct answer, C. pink frothy sputum. Explanation: option C is correct because pink frothy sputum indicates pulmonary edema, a life-threatening complication of heart failure requiring immediate medical intervention. Option A is incorrect because ankle edema is expected with fluid retention in heart failure but doesn't indicate immediate life-threatening complications. Option B is incorrect because decreased appetite is common in heart failure but doesn't represent an acute emergency requiring immediate intervention. Option D is incorrect because mild fatigue is an expected symptom of heart failure that doesn't indicate acute decompensation. Let's examine why pink frothy sputum represents the most critical finding in heart failure. When heart failure worsens and the left ventricle can't pump effectively, pressure backs up through the pulmonary veins into the lung capillaries. Eventually, this pressure forces fluid and red blood cells through the capillary walls into the alveoli. The mixture of blood and fluid creates pink-tinged sputum. The air mixing with this fluid during breathing creates the frothy appearance. This indicates acute pulmonary edema, where the lungs are literally drowning in fluid. Without immediate intervention, respiratory failure occurs within minutes to hours. Ankle edema and decreased appetite are chronic symptoms. 23. A diabetic patient presents with numbness in feet and delayed wound healing. Which intervention is most important to prevent amputation? A. Antibiotic therapy. B. Daily foot inspection. C. Compression stockings. D. Vitamin supplementation. Can you guess the answer? Correct answer, B. Daily foot inspection. Explanation: option B is correct because daily foot inspection allows early detection of injuries that diabetic neuropathy might prevent the patient from feeling, preventing serious complications. Option A is incorrect because antibiotic therapy treats existing infections but doesn't prevent the injuries that lead to amputation. Option C is incorrect because compression stockings could reduce circulation in diabetic patients with potential arterial disease, worsening wound healing. Option D is incorrect because while vitamins support healing, daily inspection to catch problems early is more critical for preventing amputation. Understanding diabetic foot care priorities reveals why daily inspection prevents amputations more than any other intervention. Diabetic neuropathy damages sensory nerves in the feet, eliminating pain signals that normally alert us to injuries. A diabetic patient can step on a nail, develop a blister, or get a cut without feeling anything. These unnoticed injuries become infected, progressing to deep ulcers and osteomyelitis. By the time the patient notices, amputation may be necessary. Daily visual inspection catches injuries when they're still minor and treatable. Antibiotics treat existing infections but don't prevent new injuries. 24. A nurse is caring for a post-colon surgery patient who develops wound dehiscence with organ protrusion. What is the priority nursing action? A. Apply pressure dressing. B. Position patient upright. C. Cover with sterile saline dressing. D. Document the findings. Do you know the answer? Correct answer, C. Cover with sterile saline dressing. Explanation: option C is correct because covering exposed organs with sterile saline-soaked dressing prevents tissue drying and infection while preparing for emergency surgical repair. Option A is incorrect because applying pressure to protruding organs could cause tissue damage and doesn't properly protect the exposed tissue. Option B is incorrect because positioning upright would increase intra-abdominal pressure, potentially worsening the evisceration and causing more organs to protrude. Option D is incorrect because while documentation is important, protecting the exposed organs takes immediate priority to prevent tissue death. Let's explore the critical management of wound evisceration, a surgical emergency where organs protrude through an open incision. When wound dehiscence progresses to evisceration, Internal organs like intestines push through the opening. These exposed organs immediately face two threats: desiccation and infection. Organs must stay moist to maintain cellular function. Covering them with sterile, saline-soaked dressings prevents tissue death while maintaining sterility. This buys time for emergency surgery. Applying pressure would damage the delicate organs. Positioning upright increases intra-abdominal pressure, potentially pushing more organs out. Every minute of exposure increases tissue damage. 25. During chemotherapy administration, a patient develops back pain, fever, and chills. What is the nurse's first action? A. Administer acetaminophen. B. Stop the infusion. C. Check vital signs. D. Notify the physician. Can you guess the answer? Correct answer, B. Stop the infusion. Explanation: option B is correct because these symptoms indicate a potential transfusion reaction or chemotherapy hypersensitivity, requiring immediate cessation of the infusion to prevent worsening. Option A is incorrect because administering medication before stopping the potential cause of the reaction could mask symptoms and delay treatment. Option C is incorrect because while vital signs are important, stopping the infusion takes priority when reaction symptoms appear. Option D is incorrect because notifying the physician is necessary, but comes after stopping the infusion to prevent further exposure. Recognizing chemotherapy reactions requires understanding why immediate cessation is critical when symptoms appear. During chemotherapy infusion, the immune system can suddenly recognize the drug as foreign and mount an allergic response. Back pain often signals this reaction, as inflammatory mediators affect nerve endings. Fever and chills indicate systemic immune activation with cytokine release. These early signs can rapidly progress to anaphylaxis. Stopping the infusion immediately prevents further drug exposure and reaction escalation. Giving acetaminophen might mask symptoms while the reaction worsens. Every second of continued infusion increases reaction severity. 26. A patient with systemic lupus erythematosus develops proteinuria and hematuria. Which organ system complication should the nurse recognize? A. Cardiac involvement. B. Pulmonary involvement. C. Renal involvement. D. Hepatic involvement. Do you know the answer? Correct answer, C. Renal involvement. Explanation: option C is correct because lupus nephritis causes glomerular inflammation leading to proteinuria and hematuria, indicating kidney involvement requiring immediate treatments. Option A is incorrect because cardiac involvement in lupus typically presents with pericarditis or myocarditis, not urinary symptoms. Option B is incorrect because pulmonary involvement causes pleuritis or pneumonitis with respiratory symptoms, not urinary changes. Option D is incorrect because hepatic involvement is rare in lupus and would present with jaundice and elevated liver enzymes. To understand lupus complications, let's examine how this autoimmune disease specifically attacks the kidneys. In systemic lupus erythematosus, the immune system creates antibodies against the body's own tissues. These antibodies form immune complexes that deposit in the kidneys glomeruli, triggering inflammation called lupus nephritis. The inflamed glomeruli become leaky, allowing proteins that should stay in blood to escape into urine. Red blood cells also leak through, creating hematuria. This kidney involvement occurs in 40% of lupus patients and can progress to kidney failure. Cardiac involvement causes pericarditis with chest pain. 27. A patient receiving aspirin therapy for peripheral arterial disease reports ringing in the ears. What should the nurse recognize this as? A. Allergic reaction. B. Ototoxicity. C. Therapeutic effect. D. Drug interaction. Can you guess the answer? Correct answer, B. Ototoxicity. Explanation, option B is correct because tinnitus or ringing in the ears indicates aspirin toxicity affecting the 8th cranial nerve, requiring dose adjustment or discontinuation. Option A is incorrect because allergic reactions to aspirin typically present with rash, bronchospasm or anaphylaxis, not isolated tinnitus. Option C is incorrect because tinnitus is not a therapeutic effect, but rather a sign of excessive aspirin levels, requiring intervention. Option D is incorrect because while drug interactions can occur, tinnitus specifically indicates direct aspirin toxicity, not an interaction effect. Let's examine how aspirin toxicity specifically affects hearing through a process called ototoxicity. Aspirin in therapeutic doses inhibits prostaglandin synthesis, providing pain relief and preventing clots. However, when levels become excessive, aspirin accumulates in the inner ear's cochlea. Here it damages the hair cells responsible for converting sound waves to nerve signals. It also affects the 8th cranial nerve directly. The first sign is usually tinnitus, that persistent ringing or buzzing in the ears. This indicates toxic levels requiring immediate dose reduction or discontinuation. This isn't an allergic reaction, which would cause rash or breathing problems. 28. A nurse is assessing a patient with bacterial meningitis. Which precaution should be implemented immediately upon diagnosis? A. Contact precautions. B. Droplet precautions. C. Airborne precautions. D. Standard precautions. Do you know the answer? Correct answer, B. Droplet precautions. Explanation. Option B is correct because bacterial meningitis spreads through respiratory droplets, requiring droplet precautions including masks within 3 feet of the patient. Option A is incorrect because contact precautions are for infections spread by direct touch, not the respiratory droplets that spread meningitis. Option C is incorrect because airborne precautions are for particles that remain suspended in air, while meningitis spreads through larger droplets. Option D is incorrect because standard precautions alone are insufficient for the contagious respiratory droplets that transmit bacterial meningitis. Understanding meningitis transmission helps us choose the right isolation precautions to protect others. Bacterial meningitis spreads through respiratory droplets when infected persons cough, sneeze or talk. These droplets are relatively large and heavy, travelling only about 3 feet before falling. The bacteria, typically Neisseria meningitidis or Streptococcus pneumonia, live in these droplets. Anyone within 3 feet can inhale them, allowing bacteria to colonise their nasopharynx and potentially invade the meninges. Droplet precautions require masks within 3 feet in private rooms. 29. A patient with chronic kidney disease has a potassium level of 6.5. Which medication should the nurse prepare to administer? A. Spironolactone. B. Sodium polystyrene. Sulfonate. C. Furosemide. D. Calcium gluconate. Can you guess the answer? Correct answer, D. Calcium gluconate. Explanation. Option D is correct because calcium gluconate stabilizes the cardiac membrane against the effects of severe hyperkalemia, providing immediate cardiac protection. Option A is incorrect because spironolactone is a potassium-sparing diuretic that would worsen hyperkalemia, not treat it. Option B is incorrect because while sodium polystyrene removes potassium, calcium gluconate provides faster cardiac protection in severe hyperkalemia. Option C is incorrect because furosemide helps eliminate potassium but doesn't provide the immediate cardiac protection needed for this critical level. Critical hyperkalemia management requires understanding why calcium gluconate is the first-line emergency treatment. A potassium level of 6.5 can trigger fatal arrhythmias within minutes. Excess potassium reduces the electrical difference between inside and outside heart cells, making them hyperexcitable. This causes ventricular fibrillation or cardiac arrest. Calcium gluconate doesn't remove potassium but stabilizes the cardiac membrane immediately. It restores the electrical threshold, protecting the heart, while other treatments work. Spironolactone would worsen hyperkalemia as it's potassium sparing. Sodium polystyrene removes potassium but takes hours. 30. A patient with osteomalacia is started on vitamin D supplementation. Which additional supplement is necessary for optimal bone healing? A. Iron. B. Calcium. C. Potassium. D. Magnesium. Do you know the answer? Correct answer, B. Calcium. Explanation: option B is correct because calcium supplementation with vitamin D is essential for bone mineralization, as vitamin D enhances calcium absorption for bone healing. Option A is incorrect because iron is important for red blood cell production, but doesn't directly contribute to bone mineralization. Option C is incorrect because potassium affects muscle and nerve function, but isn't directly involved in bone healing with vitamin D. Option D is incorrect because while magnesium supports bone health, calcium is the primary mineral needed with vitamin D for osteomalacia treatment. Osteomalacia treatment requires understanding the vital partnership between vitamin D and calcium for bone healing. Osteomalacia, adult rickets, occurs when bones lack proper mineralization. Vitamin D enables intestinal calcium absorption, but without adequate calcium available, vitamin D alone can't mineralize bones. Think of vitamin D as the key that unlocks the door for calcium absorption. Without calcium to walk through that door, the key is useless. Together, vitamin D and calcium deposit into the bone matrix, hardening soft bones. Iron helps red blood cells but doesn't mineralize bone. 31. During huff-coughing instruction for a COPD patient, what should the nurse teach as the primary purpose of this technique? A. Reduce oxygen consumption. B. Clear secretions effectively. C. Strengthen respiratory muscles. D. Prevent pneumonia development. Can you guess the answer? Correct answer, B. Clear secretions effectively. Explanation: option B is correct because huff coughing uses controlled forced expiration to mobilize and clear secretions without causing airway collapse in COPD patients. Option A is incorrect because huff coughing requires energy expenditure and doesn't reduce oxygen consumption during the activity. Option C is incorrect because while coughing uses respiratory muscles, the primary purpose is secretion clearance, not muscle strengthening. Option D is incorrect because while clearing secretions may help prevent pneumonia, the immediate purpose is effective secretion removal. Huff coughing technique in COPD serves a specific purpose that regular coughing can't achieve effectively. In COPD, airways collapse easily due to lost elastic tissue and inflammation. Forceful coughing creates high pressure that actually causes airway collapse, trapping secretions below the closure. Huff coughing uses controlled medium force exhalation with an open glottis like fogging a mirror. This maintains enough airway pressure to keep bronchioles open while moving secretions upward. The mucus gradually moves from smaller to larger airways where it's easier to expel. This isn't about oxygen conservation or muscle strengthening. 32. A patient with HIV infection develops oral candidiasis and weight loss. Which laboratory value best indicates disease progression? A. White blood cell count. B. CD4 T cell count. C. Viral load test. D. Hemoglobin level. Do you know the answer? Correct answer, B. CD4 T cell count. Explanation: option B is correct because a CD4 T cell count below 200 indicates severe immunosuppression and AIDS progression, explaining opportunistic infections like oral candidiasis. Option A is incorrect because the total white blood cell count doesn't specifically indicate HIV progression or immune system compromise. Option C is incorrect because while viral load indicates virus replication, CD4 count beta reflects immune system damage and disease stage. Option D is incorrect because the hemoglobin level indicates anemia but doesn't directly reflect HIV disease progression or immune status. HIV disease progression monitoring centers on the CD40 cell count as the key indicator. HIV specifically targets and destroys CD40 helper cells, the immune system's coordinators. These cells normally orchestrate immune responses against infections. As HIV destroys more CD4 cells, the count drops from normal 800 to 1200 down toward 200. Below 200 defines AIDS. When opportunistic infections like oral candidiasis thrive, the CD4 count directly reflects immune system damage and predicts infection risk. Total white cell count includes many cell types, not specifically CD4 cells. 33. A patient with Raynaud's disease asks about preventing attacks. Which environmental trigger should the nurse emphasize avoiding? A. Humid weather. B. Cold exposure. C. Bright sunlight. D. High altitude. Can you guess the answer? Correct answer, B. Cold exposure. Explanation. Option B is correct because cold exposure triggers vasospasm in Raynaud's disease, causing the characteristic colour changes and pain in fingers and toes. Option A is incorrect because humid weather does not trigger the vasospasm characteristic of Raynaud's disease attacks. Option C is incorrect because bright sunlight does not cause the vascular spasm that triggers Raynaud's symptoms. Option D is incorrect because while altitude affects oxygenation, it does not directly trigger the vasospasm seen in Raynaud's disease. Raynaud's disease prevention focuses on understanding the primary trigger that causes vasospastic attacks. In Raynaud's, small arteries in fingers and toes overreact to cold temperatures or stress. Cold exposure triggers excessive sympathetic nervous system activation, causing severe vasoconstriction. The vessels spasm so tightly that blood flow stops completely. This creates the classic colour changes: white from no blood flow, blue from deoxygenation, then red from reactive hyperemia when vessels finally relax. The attacks cause numbness, tingling, and severe pain. Cold is the primary environmental trigger. 34. A nurse is monitoring a patient after cardiac catheterization. Which finding at the insertion site requires immediate intervention? A. Small bruise. B. Diminished pulse. C. Mild tenderness. D. Slight swelling. Do you know the answer? Correct answer, B. Diminished pulse. Explanation. Option B is correct because a diminished pulse distal to the insertion site indicates arterial occlusion or thrombosis, requiring immediate intervention to restore circulation. Option A is incorrect because a small bruise is expected after catheterization and doesn't require immediate intervention unless it is expanding significantly. Option C is incorrect because mild tenderness is normal after the procedure and generally does not indicate a serious complication. Option D is incorrect because slight swelling is common post-procedure, but diminished pulse indicates compromised arterial flow, requiring urgent attention. Post-cardiac catheterization monitoring requires recognizing diminished pulse as a critical vascular complication. During catheterization, a large catheter enters the femoral or radial artery. After removal, complications can develop at the insertion site. A diminished pulse distal to the site indicates arterial occlusion from either thrombosis or arterial spasm. The clot or spasm blocks blood flow to the extremity, risking limb ischemia. Without immediate intervention, tissue death occurs within hours. This requires immediate thrombectomy or a thrombolytic therapy to restore circulation. Small bruising is expected from minor bleeding, but diminished pulse threatens limb viability. 35. A patient with psoriasis is prescribed methotrexate. Which laboratory tests should be monitored regularly during treatment? A. Thyroid function. B. Liver function. C. Cardiac enzymes. D. Pancreatic enzymes. Can you guess the answer? Correct answer, B. Liver function. Explanation. Option B is correct because methotrexate is hepatotoxic, requiring regular liver function monitoring to detect early signs of liver damage during treatment. Option A is incorrect because methotrexate doesn't significantly affect thyroid function, making this monitoring unnecessary for this medication. Option C is incorrect because cardiac enzymes aren't affected by methotrexate, which primarily impacts liver and bone marrow. Option D is incorrect because pancreatic enzymes aren't affected by methotrexate therapy, unlike the significant hepatotoxicity risk. Methotrexate monitoring in psoriasis focuses on liver function due to the drug's hepatotoxic potential. Methotrexate accumulates in liver cells where it interferes with folate metabolism and DNA synthesis. Over time, this causes hepatocyte damage, inflammation, and potentially cirrhosis. Even at low doses for psoriasis, cumulative liver damage occurs. Regular liver function tests detect early elevation of enzymes, like ALT and AST, indicating hepatocyte injury. Catching this early allows dose adjustment before irreversible damage. Methotrexate doesn't affect thyroid function significantly. The liver bears the brunt of methotrexate toxicity. 36. A patient presents with flank pain, hematuria, and nausea. Which condition should the nurse suspect based on these classic symptoms? A. Acute pyelonephritis. B. Kidney stones. C. Bladder infection. D. Prostate enlargement. Do you know the answer? Correct answer, B. Kidney stones. Explanation. Option B is correct because the classic triad of severe flank pain, hematuria, and nausea strongly indicates renal calculi moving through the urinary system. Option A is incorrect because pyelonephritis typically presents with fever, chills, and costovertebral angle tenderness, not just flank pain. Option C is incorrect because bladder infections cause suprapubic pain and urinary frequency, not the severe flank pain described. Option D is incorrect because prostate enlargement causes urinary retention and weak stream, not flank pain with hematuria. The classic triad of symptoms helps us recognize kidney stones immediately for prompt treatment. When a stone moves from the kidney through the ureter, it scrapes the delicate ureteral lining. This trauma causes severe colicky flank pain that comes in waves as the ureter spasms trying to pass the stone. The scraping also causes bleeding, visible as hematuria. The intense pain triggers the vagus nerve, causing nausea and often vomiting. This triad of flank pain, blood in urine, and nausea is pathognomonic for renal calculi. Pyelonephritis adds fever. 37. During a sickle cell crisis, which intervention should the nurse prioritize to reduce sickling of red blood cells? A. Blood transfusion. B. Oxygen therapy. C. Pain medication. D. Intravenous fluids. Can you guess the answer? Correct answer, D. Intravenous fluids. Explanation. Option D is correct because adequate hydration with intravenous fluids reduces blood viscosity and helps prevent further sickling of red blood cells during a crisis. Option A is incorrect because while transfusions may be needed for severe anemia, hydration is the first priority to reduce sickling. Option B is incorrect because oxygen helps with hypoxia, but hydration more directly addresses the sickling process by reducing blood viscosity. Option C is incorrect because while pain management is important, fluids directly address the pathophysiology of sickling, making it the priority. Sickle cell crisis management prioritizes intravenous fluids to address the fundamental pathophysiology of sickling. In sickle cell disease, deoxygenated red blood cells change from round to crescent shapes. These sickled cells stick together, creating blockages in small blood vessels. Dehydration increases blood viscosity, making cells more likely to sickle and clump. Aggressive IV hydration dilutes the blood. This reduces viscosity and helps sickled cells flow through vessels. This improves perfusion to tissues and reduces further sickling. Pain medication provides comfort but doesn't address the cause. Hydration breaks the sickling cycle. 38. A patient with gastroesophageal reflux disease asks about lifestyle modifications. Which recommendation would be most effective for symptom reduction? A. Exercise after meals. B. Elevate head when sleeping. C. Increase coffee intake. D. Eat larger meals. Do you know the answer? Correct answer, B. Elevate head when sleeping. Explanation. Option B is correct because elevating the head of the bed 6 to 8 inches uses gravity to prevent stomach acid reflux during sleep. Option A is incorrect because exercising after meals increases abdominal pressure and can worsen reflux symptoms, not improve them. Option C is incorrect because coffee relaxes the lower esophageal sphincter and increases acid production, worsening gastroesophageal reflux disease symptoms. Option D is incorrect because larger meals increase stomach pressure and acid production, while smaller frequent meals reduce symptoms. GERD lifestyle modifications work by addressing the mechanical factors that allow acid reflux. When lying flat, stomach acid easily flows backward into the esophagus due to gravity. Elevating the head of bed 6 to 8 inches uses gravity to keep acid in the stomach where it belongs. This simple position change significantly reduces nighttime reflux when the lower esophageal sphincter naturally relaxes. Exercise after meals increases intra-abdominal pressure, forcing acid upward. Coffee relaxes the sphincter and stimulates acid production, worsening symptoms. The elevated sleeping position provides continuous protection throughout the night. 39. A nurse is assessing an unconscious patient for pain. Which indicator would be most reliable for detecting pain in this patient? A. Blood pressure changes. B. Facial grimacing. C. Decreased respirations. D. Skin temperature. Can you guess the answer? Correct answer, B. Facial grimacing. Explanation. Option B is correct because facial grimacing is a reliable non-verbal pain indicator in unconscious patients, as facial expressions persist despite altered consciousness. Option A is incorrect because blood pressure changes can result from many factors besides pain in unconscious patients. Option C is incorrect because decreased respirations could indicate neurological depression rather than pain response in unconscious patients. Option D is incorrect because skin temperature changes aren't specific to pain and can result from various physiological processes. Pain assessment in unconscious patients relies on understanding which nonverbal cues remain reliable. Even when consciousness is lost, the facial muscles retain their reflexive response to painful stimuli. The brain's primitive pain pathways trigger facial grimacing without requiring conscious awareness. This creates consistent facial expressions like furrowed brows, tightened eyes, and clenched jaw. These facial changes are specific to pain. Unlike vital sign changes, blood pressure fluctuates from multiple factors in unconscious patients. Facial grimacing provides the most reliable, specific indicator requiring intervention. 40. A patient with cirrhosis develops confusion and asterixis. Which medication should the nurse prepare to administer? A. Lactulose, B. Furosemide, C. Propranolol, D. Spironolactone. Do you know the answer? Correct answer, A. Lactulose. Explanation: option A is correct because lactulose reduces ammonia levels by promoting its excretion, treating hepatic encephalopathy manifested by confusion and asterixis. Option B is incorrect because furosemide treats fluid overload but does not address the elevated ammonia causing hepatic encephalopathy. Option C is incorrect because propranolol prevents variceal bleeding but does not treat the ammonia elevation causing neurological symptoms. Option D is incorrect because spironolactone manages ascites but does not reduce ammonia levels causing the encephalopathy. Hepatic encephalopathy treatment centers on understanding how lactulose removes the toxin causing brain dysfunction. In liver failure, the damaged liver can't convert ammonia from protein breakdown into urea for excretion. Ammonia accumulates crossing the blood-brain barrier where it disrupts neurotransmission. This causes the confusion and asterixis, that flapping tremor we observe. Lactulose works through two mechanisms. It acidifies the colon, converting ammonia to non-absorbable ammonium. It also causes osmotic diarrhea, physically removing ammonia from the body. This rapidly lowers ammonia levels, improving mental status. 41. A patient receiving radiation therapy develops skin redness and irritation. Which product should the nurse advise avoiding on the treatment area? A. Aloe vera gel, B. Petroleum products, C. Fragrance-free lotion, D. Mild soap. Can you guess the answer? Correct answer, B. Petroleum products. Explanation: option B is correct because petroleum-based products can intensify radiation effects and trap heat in tissues, potentially worsening skin damage during treatment. Option A is incorrect because pure aloe vera gel without alcohol is often recommended for soothing radiation-induced skin irritation. Option C is incorrect because fragrance-free lotions are generally safe and recommended for moisturizing radiated skin between treatments. Option D is incorrect because mild, fragrance-free soap is acceptable for gently cleansing the treatment area as directed. Radiation therapy skincare requires understanding why petroleum products create dangerous complications. During radiation treatment, high-energy beams pass through skin to reach tumours. The skin absorbs some radiation energy. This causes inflammation and sensitivity. Petroleum-based products create an occlusive barrier that traps heat in the tissue. This intensifies the radiation's thermal effects, essentially cooking the skin from within. Additionally, petroleum can create a bolus effect, increasing the radiation dose to skin surface. This combination dramatically worsens radiation burns. Pure aloe without alcohol soothes inflammation safely. 42. During assessment of a patient with compartment syndrome, which finding would appear first as pressure increases? A. Absent pulse, B. Severe pain, C. Paralysis, D. Pale skin. Do you know the answer? Correct answer, B. Severe pain. Explanation: option B is correct because severe pain, disproportionate to the injury, is the earliest sign of compartment syndrome, appearing before vascular or nerve compromise. Option A is incorrect because absent pulse is a late sign appearing after prolonged pressure has compromised arterial flow. Option C is incorrect because paralysis occurs late in compartment syndrome after nerves have been damaged by prolonged pressure. Option D is incorrect because pallor is a later sign occurring after arterial blood flow has been significantly compromised. Compartment syndrome progression follows a predictable pattern that helps us catch it early. When pressure builds within a muscle compartment, the first structure affected is sensory nerves. These delicate nerves are extremely sensitive to pressure changes. The patient experiences severe pain disproportionate to the visible injury, often described as deep, constant, and worsening. As pressure continues building, it compresses arteries, causing pulselessness. Next comes paralysis as motor nerves fail. The key is recognizing that severe pain comes first, hours before the late signs. 43. A patient with diverticulosis asks about dietary changes to prevent complications. What should the nurse recommend increasing in the diet? A. Red meat. B. Dairy products. C. Fiber intake. D. Processed foods. Can you guess the answer? Correct answer, C. Fiber intake. Explanation: option C is correct because a high-fiber diet prevents constipation and reduces pressure in the colon, helping prevent diverticulitis in patients with diverticulosis. Option A is incorrect because red meat is low in fiber and may increase colon pressure, potentially worsening diverticular disease. Option B is incorrect because dairy products don't provide the fiber needed to prevent complications of diverticulosis. Option D is incorrect because processed foods are typically low in fiber and high in refined ingredients that worsen constipation. Diverticulosis management centers on preventing the complications that turn pouches into problems. Diverticulosis means small pouches have formed in the colon wall at weak points. These pouches, called diverticula, usually cause no symptoms. However, when stool gets trapped in them, bacteria multiply, causing diverticulitis inflammation. High-fiber diet prevents this by keeping stool soft. Fiber reduces the pressure needed for bowel movements, preventing new pouches from forming. It also helps stool pass quickly, reducing the chance of getting trapped. Red meat lacks fiber. 44. A nurse notices yellow-brown discoloration of body fluids in a tuberculosis patient. Which medication is causing this expected side effect? A. Isoniazid. B. Rifampin. C. Ethambutol. D. Pyrazinamide. Do you know the answer? Correct answer, B. Rifampin. Explanation: option B is correct because rifampin causes harmless orange-red to yellow-brown discoloration of body fluids including urine, tears and sweat. Option A is incorrect because isoniazid causes peripheral neuropathy and hepatotoxicity, but doesn't discolor body fluids. Option C is incorrect because ethambutol can affect vision, but doesn't cause the characteristic body fluid discoloration. Option D is incorrect because pyrazinamide causes hyperuricemia and joint pain, but doesn't change body fluid color. Rifampin's distinctive side effect helps us understand medication compliance in tuberculosis treatment. Rifampin contains a powerful orange-red pigment that isn't metabolized by the body. This pigment distributes throughout all body fluids after absorption. Within hours of taking rifampin, patients notice orange discoloration of urine, tears, sweat, and even saliva. This dramatic color change is completely harmless, but can stain clothing and soft contact lenses permanently. Patients need reassurance that this is expected, not dangerous. Only rifampin creates this discoloration. 45. A patient with acute kidney injury has not urinated in 12 hours. Which phase of acute kidney injury is this patient experiencing? A. Initiation phase. B. Oliguric phase. C. Diuretic phase. D. Recovery phase. Can you guess the answer? Correct answer, B. Oliguric phase. Explanation: option B is correct because the oliguric phase is characterized by urine output less than 400 milliliters per day, indicating severe kidney dysfunction and reduced urine production. Option A is incorrect because the initiation phase is when the kidney injury begins, and urine output may still be normal or slightly decreased, but are not absent for 12 hours. Option C is incorrect because the diuretic phase involves excessive urine output as the kidneys begin recovering function, which is the opposite of the patient's current condition. Option D is incorrect because the recovery phase involves a gradual return to normal kidney function, with normalized urine output, indicating that the kidneys are starting to heal, but this patient is experiencing a lack of urine output. Acute kidney injury phases help us understand where the patient is in their kidney failure journey. The oliguric phase is the most dangerous period following kidney injury. During this phase, the kidneys essentially shut down, producing less than 400 millilitres of urine daily, sometimes none at all. Waste products like creatinine and urea accumulate rapidly. Potassium builds to dangerous levels, threatening cardiac arrest. Fluid overload develops, causing pulmonary edema and hypertension. This phase typically lasts 1 to 2 weeks. 46. During perioperative care, a patient develops malignant hypothermia. What is the priority medication to administer? A. Acetaminophen. B. Dantrolene sodium. C. Calcium chloride. D. Potassium chloride. Do you know the answer? Correct answer, B. Dantrolene sodium. Explanation. Option B is correct because dantrolene sodium is the specific antidote for malignant hypothermia, stopping the hypermetabolic crisis by blocking calcium release. Option A is incorrect because acetaminophen won't treat the life-threatening hypermetabolic state of malignant hypothermia. Option C is incorrect because calcium chloride would worsen the condition by increasing the calcium that triggers muscle contractions. Option D is incorrect because potassium chloride doesn't address the underlying pathophysiology of malignant hypothermia. Malignant hypothermia treatment requires understanding this rare but deadly anesthetic reaction. Certain anesthetics trigger uncontrolled calcium release from muscle cells' sarcoplasmic reticulum. This floods muscle fibers with calcium, causing sustained contractions throughout the body. Muscles generate tremendous heat from this hypermetabolic state, raising body temperature dangerously fast. Without treatment, organs fail from hypothermia and acidosis. Dantrolene sodium is the specific antidote that blocks calcium release channels, stopping the crisis. Only dantrolene saves lives. 47. A patient with COVID-19 develops respiratory distress requiring prone positioning. What is the primary benefit of this intervention? A. Reduces work of breathing. B. Improves ventilation perfusion. C. Decreases oxygen demand. D. Prevents aspiration. Can you guess the answer? Correct answer, B. Improves ventilation perfusion. Explanation. Option B is correct because prone positioning redistributes perfusion to better ventilated lung areas, improving oxygen exchange in severe COVID-19 respiratory failure. Option A is incorrect because prone positioning doesn't directly reduce the work of breathing and may initially feel more difficult. Option C is incorrect because prone positioning doesn't decrease the body's oxygen demand, but rather improves oxygen delivery efficiency. Option D is incorrect because while positioning affects aspiration risk, the primary purpose is improving ventilation perfusion matching. Prone positioning in severe COVID-19 works through a fascinating redistribution of lung perfusion. In supine position, gravity pulls blood predominantly to the posterior lung regions. However, COVID pneumonia primarily affects these dependent posterior areas, creating severe ventilation perfusion mismatch. When we flip patients prone, gravity redirects blood flow to the anterior lung regions. This dramatically improves oxygen exchange by matching blood flow with functional alveoli. Additionally, prone positioning relieves pressure from the heart and abdominal organs on the lungs. It's about optimizing ventilation perfusion matching. 48. A patient with hyperthyroidism is scheduled for radioactive iodine therapy. What important teaching should the nurse provide post-treatment? A. Increase physical activity. B. Avoid close contact. C. Consume iodized salt. D. Stop all medications. Do you know the answer? Correct answer. B. Avoid close contact. Explanation: option B is correct because patients remain radioactive after treatment and must avoid close contact with others, especially children and pregnant women. Option A is incorrect because activity level doesn't need to increase, and patients may feel fatigued during the treatment period. Option C is incorrect because additional iodine intake isn't necessary and could interfere with the treatment's effectiveness. Option D is incorrect because medications shouldn't be stopped without provider approval, and some may need to continue. Radioactive iodine therapy safety focuses on protecting others from radiation exposure after treatment. The thyroid gland naturally concentrates iodine, including the radioactive isotope given for hyperthyroidism treatment. After swallowing the radioactive iodine capsule, patients become temporarily radioactive themselves. They emit gamma radiation that can affect people nearby, especially vulnerable populations like children and pregnant women. Patients must maintain 6 feet distance for several days, sleep alone, and use separate bathrooms when possible. Children's rapidly dividing cells are highly sensitive to radiation damage. 49. A nurse is caring for a patient with ascending paralysis and respiratory muscle weakness. Which condition is most likely causing these symptoms? A. Multiple sclerosis. B. Guillain-Barré syndrome. C. Myasthenia gravis. D. Parkinson's disease. Can you guess the answer? Correct answer, B. Guillain-Barré syndrome. Explanation: option B is correct because Guillain-Barré syndrome characteristically causes ascending paralysis starting in legs and progressing upward, potentially affecting respiratory muscles. Option A is incorrect because multiple sclerosis causes varied neurological symptoms with exacerbations and remissions, not typical ascending paralysis. Option C is incorrect because myasthenia gravis causes muscle weakness that worsens with activity, not the ascending paralysis pattern described. Option D is incorrect because Parkinson's disease causes tremor, rigidity, and bradykinesia, not the ascending paralysis pattern. Guillain-Barré syndrome creates a distinctive pattern of paralysis that helps identify this emergency condition. This autoimmune disorder occurs when antibodies attack the myelin sheath of peripheral nerves. The attack typically begins in the longest nerves first, those reaching the feet. Paralysis starts in the toes and feet, then ascends to legs, trunk, arms, and finally respiratory muscles. This ascending pattern is pathognomonic for Guillain-Barré. As it reaches the diaphragm and intercostal muscles, breathing becomes impossible without mechanical ventilation. Death occurs from respiratory failure if not recognized. 50. During hemodialysis, a patient complains of headache and nausea. The nurse should recognize these as early signs of which complication? A. Air embolism. B. Disequilibrium syndrome. C. Hemolysis. D. Thrombosis. Do you know the answer? Correct answer, B. Disequilibrium syndrome. Explanation: option B is correct because disequilibrium syndrome occurs when rapid solutor removal causes cerebral edema, presenting initially with headache and nausea. Option A is incorrect because air embolism causes chest pain, dyspnea, and a churning sound in the heart, not headache and nausea. Option C is incorrect because hemolysis during dialysis would cause chest pain, dyspnea, and blood in the dialysis lines. Option D is incorrect because thrombosis affects blood flow through the access site, but does not cause the neurological symptoms described. Disequilibrium syndrome during hemodialysis presents with specific neurological symptoms we must recognise immediately. When dialysis removes waste products too rapidly, it creates an osmotic imbalance between blood and brain tissue. The blood becomes suddenly clean while the brain still contains high concentrations of urea and other solutes. Water follows the concentration gradient, moving from blood into brain cells to equalise the osmotic pressure. This causes cerebral edema, increasing intracranial pressure. Early symptoms include headache from the pressure and nausea from brainstem irritation. Without intervention, this progresses to seizures and coma. You have reached the end of our first question set. For the free complete exam preparation, visit our website link in the description, where you find thousands more practice questions and comprehensive study guides. Thanks for studying with us today. See you in the next video.